Alright guys, welcome back to another video. Today we're going to go over the osteology of the hind foot. So just as an overall introduction, the main joints of the foot are the talocrural joint, which would be between the talus and the cuboid and the navicular bones. You also have your your talocrural joint would be between your tibia, your talus, and your lateral medial or articular facet. So your talocrural joint is actually up here, not here. This, I believe, is your left frank joint. Oh no, this is your mid-tarsal joint between the rear foot and the midfoot. So your left frank joint would be here, between the midfoot and the forefoot. There are 7 tarsals, 7 tarsal bones, your calcaneus, your talus, your navicular, 3 cuneiforms, and your cuboid would be the 7 tarsals. And you have, of course, 5 metatarsals, labeled 1 through 5, and 14 phalanges associated with them. So before we get into the talus, just some more introductory information here. The foot has made up of 3 arches. You have the medial longitudinal arch. Zoom in here. You have your medial longitudinal arch, which is made up of your calcaneus bone, and other bones within the foot. You have your, in addition to the medial longitudinal arch, the spring ligaments would be attached within, it'll be within that axis. You also have your lateral longitudinal arch, which is where the long and short plantar ligament would be associated with. Excuse me. And then you have your transverse arch coming across this way. From lateral to medial, which is where the intermediate cuneiform and the second base of the metatarsal would be at, and where the anterior cuneiform ligaments would be attaching to. So your head of talus would be where the keystone is being formed, and you have your spring ligament and long and short plantar ligament, which are very important. So again, the spring ligament would be the medial longitudinal arch, and the lateral longitudinal arch would be with the long and short plantar ligament. So the talus has no muscle attachments. It's the second largest bone of the foot and ankle after the calcaneus, and has multiple ligament attachments. So the head of the talus, this is the inferior view. So your head of the talus, this is the medial view. The head of the talus is going to be on this side anteriorly. So you have your head, your body, which is like the whole thing, and the neck. The body has 5 surfaces. So you have your posterior surface. You have your posterior surface of the talus. You have your lateral surface of the talus. You have your medial surface, which would be on, of course, the other side, because this is a lateral view we're looking at right now. You have your inferior surface and your anterior surface. So 5 surfaces: anterior, lateral, medial, inferior, posterior. And a lot of these bones, they're gonna have the same number of surfaces, right? Because of their orientation. So the lateral side of the talus is going to articulate with the tibial profound and create the lateral malleolus. You have your lateral malleolar facet here, and on the other side, you'll have your medial malleolar facet. The posterior process has two tubercles. Let's see if we can find it here. Maybe another image. Okay, well, we can't find it right now, but there's two processes on the posterior side. You can kind of see one of them here. The medial and lateral tubercle. And the lateral tubercle on the the lateral tubercle, the posterior process, when it's fractured, can be known as Shepherd's fracture. And os trigonum occurs when you have a failure fusion of the lateral tubercle. You also have the posterior facet of the talus, which would be where the calcaneus is going to articulate with the talus on this portion right here. And moving on, we have the neck of the talus. So the talus neck is going to begin at the anterior border of the trochlea. So right here, this is where the neck would begin. This is the main portion of the neck of the talus. And one of the important features is the sulcus talus, which is going to be a groove that forms with the tarsal canal and the calcaneal sulcus. So like right here would be that groove. Right here you'll see tarsal sinus, also known as sinus tarsi. And so yeah, that's pretty much it for the neck of the talus. The head of the talus, which again, right, remember guys, the anterior side, head of the talus. This is just a lateral view. In this picture, you see the head of the talus up here is going to articulate with the navicular bone. So the head of the talus is going to articulate with the navicular bone. The head of talus is going to articulate with the bone. And you also have your angle of talar torsion, which is the angle between the longitudinal axis of the head and the transverse plane. So you can see that here. This is your angle of talar torsion. This is the lateral side. This is the medial side. So this is the transverse plane and the longitudinal axis of the head. This is that talar torsion angle. Okay, moving on to the blood supply of the talus. The blood supply of the head and neck is going to be the dorsalis pedis and branches from dorsalis pedis, medial lateral tarsal arteries, and the anterior tibial arteries. And you also have contributions from the tarsal canal and artery of sinus tarsi. The body of the talus is going to be supplied by the deltoid artery, the artery of sinus tarsi, and the artery of the tarsal canal. The talus is innervated by branches from the deep fibular nerve, the tibial nerve, the saphenous nerve, and the sural nerves. The ossification of the talus occurs within 6 months. And that's it about the talus.